Good day, sir. Now I will be performing the obtaining capillary blood sample for the glucose testing and monitoring. So, the purpose of this assessment po is to provide a convenient, rapid, and accurate measurement of blood glucose. So, for the equipment, blood glucose meter, sterile lancet, cotton ball, organs squares, testing strip for meter, non-sterile gloves, additional PPE as indicated, soap, and water alcohol swab. So for the assessment, assess the patient's history for the indicates necessitating the monitoring of the blood glucose. And also assess the patient's knowledge about the monitoring blood glucose, inspect the area of the skins to be used for the test. And after that is punta na po tayo sa procedure. Check the patient's medical record of nursing plan of care for monitoring schedule. You may decide that additional testing indicated based on nursing judgment and the patient's condition. And also, this is to confirm the scheduled times for the checking blood glucose. Independent nursing judgments may lead to the decisions to test more frequently based on the patient's conditions. And also, gather the equipment. So, this is to provide the organized approach to the task. And also, perform hand hygiene and put on PPE if indicated. This is to prevent transmissions of the microorganism. And also identify the patients and explain the procedure to the patients and instruct the patients about needs for the monitoring blood glucose. Good day, ma'am. I'm MIAKA KAYE, Vijandre student nurse from Muslim University of the Philippines po. And now I will be performing the complete blood glucose po. Dito po malalaman kung normal po ba yung blood level of the blood glucose nyo po. So, identifying the patients, ensure the right patients receives the intervention and help to prevent error. Explanations helps to alleviate anxiety and facilitate cooperation. So, ma'am, please state your name po.
Magana po.
Okay, thank you po. And close the curtain around the bed and close the door to the room if possible. And after that is turn on the monitor. The monitor must be on for use and put on sterile gloves. Glove is protect the nurse from the exposure to the blood and or body fluids, and also prepare the lancets using the aseptic technique. And after that is aseptic technique maintains sterility, and also remove the strip from the vial, and also recap the container immediately and test the strip also individually and check that the code number for the strips matches the code number of the monitor strip. So immediate recapping protects the strip from the exposure to humidity, light, and discoloration matching code numbers on the strip, and glucose monitor ensure that the machine is calibrated correctly. And also, insert the strip into the meter according to the direction for that as a specific device. And also correctly inserted strip to the meter to read the blood glucose level of accurately. Ito na po yun. And also for the adult, massage size of the fingers toward the puncture site. Ito po yung massage is encourages the blood to flow to the area, and also cleans the skin with the alcohol swab and let it dry completely. Then po natin siyang mag-dry. So, alcohol can interfere with the accuracy of the results if not completely dried. And also, hold the lancet perpendicular to the skin and press the site with the lancet. So, ito po. Assume ko po na ito po yun. Tapos, holding the lancet in a proper position is facilitate the proper skin penetration. Also, wipe any first drop of blood with a gauze square and cotton ball if recommended by manufacturer of the monitor po. So, wipe muna natin first blood niya. And manufacturer recommend discard the first drop of blood which may be contaminated by the serum or cleansing product producing an inaccurate reading. So, encourage bleeding following hand. Make sure the gravity lightly stroke the fingers until sufficient amount of the blood has formed to cover the sample area of the strip based on the monitor requirements. So, check the instructions of the monitor and take care not to squeeze the finger, not to squeeze and puncture the site, to not touch the puncture site of the blood. So, an appropriate size droplet facilitate accurately test result. Squeezing can cause injury to the patients and alter the test result. So, gently touch a drop of the blood to test it without smearing. Smearing. And smearing blood strip may result in inaccurate test result. So, press the button if directed by the manufacturer. And also, correct timing procedure, accurate results. And also, pag nangyari na po siya is apply a puncture site with a cotton ball and dry gas. And do not, wag na siyang iwawipe ng alcohol. Naman, pwede po bang so, pressure causes homostasis, alcohol stings and may prolong bleeding. So, with the bad glucose result and document appropriately at the bedside, inform the patients of the result. So, ma'am, the result po is 88, which is normal po. So, turn off the meter, remove test strip, and dispose of the supplies appropriately. Place lancet in sharp container. So, proper disposal prevents exposure to the blood and accidental needle stick. Remove gloves and any other PP if used, and also perform hand hygiene. So, removing PPE properly reduces the risk of the infections, transmissions, and contaminations of the other items, and hand hygiene reduces the transmissions of the microorganism. And after that po is document relevant data. That's all po. Thank you.